I am Dr. Kumar Abhishek, consultant dermatologist, Institute. Today we are going to discuss about psoriasis. Psoriasis is an immunologically mediated disease that affects the skin, joints and the nails and many a times the internal organs. It has got significant impact on the quality of life of the patient and his or her family. It is very often associated with comorbidities like diabetes, blood pressure, hypertension which we call, obesity, metabolic syndrome and other cardiac related problems as well. There are certain environmental factors which also affect this disease. As I told you, it is basically immunologically mediated, but there are several diseases, several causes or factors which can trigger up the disease. The factors are smoking, alcohol, excessive emotional or physical stress, and even sometimes the patients who are having psoriasis taking steroids, orally taking steroids can also increase the disease. So what are the clinical features of this disease? This disease presents with reddish rashes along with flaking of the skin. Usually it involves the elbows, the knees, hands and legs, the scalp as well as the lower back and the nails as well. In the nails, the nails can become brittle as well as there can be small pits in the nails. Coming to the complications, it can be very severe. It can involve the whole body can be involved, and sometimes there can be infections as well. Sometimes when the joints are involved, it is also known as psoriatic arthritis. There can be severe pain in the joints with swelling. In those scenarios, the patient needs to be addressed immediately. Also, the disease itself can have simultaneously other diseases like diabetes and hypertension, or also certain cardiac problems which also need to be addressed. So coming to the treatment of psoriasis, psoriasis as such is not impossible to be treated, but yes, we can definitely give a patient disease-free life. There are many options of treatment like immunosuppressives. We can have methotrexate, cyclosporin, and the newer molecule on the block is apremilast. These are various options that we have in our armamentarium to treat the patient and give a very good quality of life. Apart from these, other safe modes of treatment are phototherapy. Phototherapy is a very safe option of treatment where the patient will have good remission without any much of side effect. The latest innovations in medical science has led to the development of biologics. Biologics are those molecules which have been found to have very good results in psoriasis, and they give results without much of side effects. Yet those are on higher side as far as price is concerned, but yes, they are very good in treatment. Coming to the precautions which we need to exercise while treating the patients of psoriasis, there are certain steps that the patient needs to observe. There are certain precautions that the patient needs to observe, like avoiding alcohol and smoking. The patient should always avoid excessive physical or mental stress. They should take good balanced diet to replace the loss of proteins and nutrients. And also always the patient should always visit a certified dermatologist